All right, so this is going to be for the IV insertion skill. Before you start your skill, you need to make sure you have a doctor's order. And so your doctor's order will tell you what it is that you need to do and what you need to instill as far as IV fluid. And you want to make sure, obviously, you know why your patient needs to have that fluid, what is their condition. You need to know what the information about the fluid you're going to infuse, the rate, any special properties of the medication or the fluid you need to know about, and lab values for your patient. Once you decide you have all your information in order, you want to go ahead and gather the equipment that you're going to need to bring into your patient's room. The things you're going to need are your IV start kit. Inside of here is your tegaderm, your gauze, your tourniquet, your tape, your gloves for this kit. It has ChlorPrep as well, and everything is ready, set to go. You need an extension set, also called the saline lock. You need a saline flush, and you need angiocasts that are appropriate for the size of the patient's veins that you're going to use, and also appropriate for what it is you're going to be administering. So the first thing you're going to do is obviously knock, wash your hands as you walk into the room, because you want to have nice clean hands. You have your equipment on a nice clean surface. Introduce yourself to a patient. Identify your patient using 2 patient identifiers. And you're going to tell the patient what you're going to do is infuse IV fluid per the MD's order. The patient understands what they're going to do. They're agreeing. You can ask if they've had the skill done to them in the past. Talk about that if you need to, and then go ahead and set your equipment up and get it ready, set to go. So in order to set my equipment up, what I want to do is I want to open up my IV catheter, my IV start kit. Inside of here is my gloves. I don't need to put those on just yet. I have a ChlorPrep pad, which is self-contained here. I like to keep good aseptic technique, so I tend to keep everything in its tray. I'm going to open it up. I'm going to activate it by cracking it, squishing it so that the fluid comes to the end, and just setting it to the side, ready, set to go. I have tape and tegaderm in here. I'm going to go ahead and open up my tegaderm. I'm going to set it to the side of a clean surface so that that area is not going to be touching, the part that's going to be touching the skin is not touching any other surface. It's just attached, ready, set for me to grab. I'm going to get my tape ready, set to go. I'd like to take about a 3 to 5 inch piece of tape, tear it, and I'm going to tear it in half again. I can do a couple of different taping techniques. I'm going to set that down, again, ready, set to go. I'm going to take my extension set. I'm going to open it up, and again, any equipment, make sure that nothing is expired. Again, keeping everything in its own kit. I'm going to just take off the end port of here, so when I go to attach it, I don't have anything in my way. Okay. So now I have my saline lock here. I'm going to open up my sterile saline. Opening it up here, I'm going to, best technique and suggestion I have for you is with these syringes, to go ahead and pull down on the plunger to allow air in. It kind of releases the seal in here, and then go ahead and prime it all the way till water's coming up the very tip. Then using aseptic technique, attach it to the end of the saline lock. It's a lower lock, so it just screws on. Then you go ahead and prime that lock until just fluid is coming out the very tip there. And set that and leave that in its tray, ready, set to go. I'm going to go ahead and open up my IV catheter. And what is a good idea to do is take it out of its holster here. You can see this is the blue angiocath on top of the stylet. What you're going to do is just do a little heat seal click here. You can see how in line that there is a little bevel here that's in line with the white port, how you deactivate the syringe. You can see the bevel and how it's shaped up. All you can do is a little heat seal click, turning it to the side and back, kind of slides into its groove, and it's back in line again. You haven't touched any part of the needle there. You're going to just let it sit gently in its tray. Okay, now I'm going to send my attention to my patient. All right, so now I'm going to go ahead and attach my tourniquet to my patient so I can go ahead and assess for the vein that I need to use. I want to attach it 4 to 6 inches above the insertion site of where I'm planning to go. I'd like to avoid the dominant hand. I'd like to ideally do it in non-dominant hand. A way I do distal to proximal. I'd look at a way that would not interfere with ADLs. Avoid areas of pain. I would assess by pressing down and assessing for nice, bouncy, resilient veins. Ideally on this patient, as I've assessed them, I can palpate a vein. It's in the antecubital site here. Nice, bouncy, and resilient. And that's where I'm going to go. I've already set up my equipment, so I can go ahead. I've already washed my hands. I can go ahead and apply my gloves and get ready, set. So I'm going to put on my gloves. I'm going to clean my site. Now with chlorhexidine or ChloraPrep, you can just scrub the site that you're going to use. So I can just scrub. I don't have to do concentric circles like I would with alcohol. I'm just going to scrub the heck out of this vein here, okay? I'm also going to scrub my index finger, my thumb, and my middle finger, any fingers that might be used to help assess the site again, okay? So those are ready, set to go. I'm going to allow this to dry. This is a mannequin, so still be a little bit shiny. And let it to dry, and you're not going to see this, but I'm going to go ahead and pat it dry, okay? So it's air dried on my real patient now. I'm going to go ahead and take out my angiocath. It's already had the heat seal done to it. Okay, so I've assessed my site. I understand where I'm going to go. I'm pulling retraction away from my site. I've palpated with my index finger where I'm going to go. I'm using a 10 to 30 degree angle. I'm going to pierce the skin. I'm going to see the flashback in my angiocath here. I'm going to lower down and advance just 1/8 of an inch. I'm going to take, holding traction still, advance my catheter. I'm going to occlude my catheter. I'm going to hold on to the angiocath. I'm going to click my IV. I'm going to detach my tourniquet, and I'm going to attach my saline lock and twist it on, okay? This is a mannequin, so the blood flows very rapidly, and even if it's your patient, that's fine. You can always take 2x2s and clean up any blood that would happen. This is not bleeding anymore because my angiocath is attached to my saline lock. I never want to let go of this, otherwise my IV will come out. I'm going to hold this down just very gently as I take, and I make sure that my catheter is patent. So I can flush fluid in. I can even pull back just a smidge and see blood coming back in the tubing. I want to advance all that saline in, and because then there's positive pressure in there, I want to go ahead and take my slide clamp of my IV catheter and close that. That way no blood will be coming ideally back into my catheter. I then want to take and detach my saline lock from my syringe or fluid here, okay? And then I want to do taping. You can see I'm still holding down on this catheter so I don't lose it. I can either do a chevron technique, which is taking both ends of the catheter. I tend to make a little tray of tape. I go underneath the port, making sure that I don't bend. And I'm going to chevron and go over my catheter. Okay, that holds it in place. It has counter traction. Then I can go ahead and kind of let go if I were to need to, because that's being held in place. My tegaderm is going to be placed right on top of the edge of that saline lock. I'm going to wrap it around so I make an occlusive seal. I'm going to take and then take off this paper covering here. It will come off. Okay, and as I take this off, I'm just being sure that this adheres to the patient, okay? And on this saline lock part, this part here, it has areas to time, date, and initial my IV. I would go in ahead with a ballpoint pen, I'd fill that information in, and then you can see it's just, all it is a piece of adhesive tape here. I'd want to tape it to the side, still on top of that tegaderm, not on top of the patient's skin. I also want to make sure that I reattach the saline lock here so I don't just have an area that dangles, could be risk of pulling out. So I can go ahead and tape. I can kind of pinch tape on either side and pinch tape on this side as well to allow some play to attach a syringe in here, but still is attached well to my patient. After I'm done, I can go ahead and take out my tourniquet, reassure my patient everything went well, reassess my site, go ahead and clean up my supplies, take out my gloves and wash my hands, and go ahead and document.